Tadalafil, better known by the brand name Cialis, is one of the most prescribed medications for erectile dysfunction worldwide. Many men over 40 and 50 rely on it to restore confidence, intimacy, and performance. Yet, urologists report that a surprising number of men fail to experience its maximum benefits. In fact, some even stop using it prematurely, believing the medication doesn't work for them, when the real problem is how they're taking it. Tadalafil works by enhancing blood flow to the penis, but its effectiveness is highly dependent on lifestyle, timing, and certain daily habits. Unlike medications that deliver a short burst, Tadalafil stays active in the body for up to 36 hours, meaning it requires a slightly different approach to maximize its impact. Mistakes in dosage, timing, diet, or hydration can all weaken its results. Urologists emphasize that success with Tadalafil is about more than just swallowing a pill. It's about creating the right internal environment for the drug to work at its full potential. That means understanding how food, alcohol, hydration, and sexual stimulation interact with the medication, and knowing the little adjustments that make a big difference. If you're using Tadalafil or considering it and you want to unlock its full potential for stronger, longer-lasting results, then you're in the right place. In this video, we'll share 5 proven, urologist-approved tips that can transform how Tadalafil works for you. Make sure to subscribe to our channel right now and turn on notifications, because the next chapters will reveal exactly what most men are doing wrong and how you can finally get the results you deserve. One of the most common misconceptions about Tadalafil is that you can take it at any time and expect instant results. Unlike some fast-acting medications for erectile dysfunction, Tadalafil works differently. It has a slower onset but a much longer duration, lasting up to 36 hours in the bloodstream. This means that timing is critical if you want to experience its maximum effect. Urologists recommend taking Tadalafil at least 30 to 60 minutes before anticipated sexual activity, though some men notice optimal effects after 2 hours. Because the drug remains active for more than a day, you don't have to rush or feel pressured to perform immediately. Instead, you gain a broader window of opportunity, but only if you plan ahead. It's also important to take Tadalafil at the same time of day if you're on a daily low-dose prescription, 2.5 to 5 milligrams. This consistency keeps blood levels stable, allowing for spontaneous intimacy without waiting for the pill to kick in. Men who skip doses or take them at random times often report weaker or inconsistent results. The bottom line, don't treat Tadalafil like an on-demand switch. Think of it as laying the groundwork for better performance. By respecting the timing, whether as needed or daily use, you give your body the best chance to respond fully when the moment comes. Many men don't realize that food, especially heavy or fatty meals, can blunt the effectiveness of Tadalafil. While the medication is absorbed in the intestines and not as sensitive to food as some other drugs, research shows that taking it right after a rich, high-fat meal can delay absorption and reduce peak concentration in the blood. In simple terms, the pill may take longer to work and may not feel as strong. Urologists often recommend taking Tadalafil on an empty stomach or after a light meal to ensure faster, more predictable absorption. For example, a small portion of lean protein and vegetables is unlikely to interfere, while a steak dinner with fries and creamy sauces may slow everything down. For men who plan intimacy in the evening, this distinction can mean the difference between results showing up in 30 minutes versus hours later. Alcohol intake also plays a role here. While Tadalafil itself doesn't interact directly with moderate alcohol use, combining it with heavy drinking can lower blood pressure excessively, leaving you dizzy, fatigued, and unable to achieve a firm erection. In addition, alcohol dehydrates the body, further reducing circulation to the pelvic region. The rule of thumb is simple. If you want Tadalafil to work at its best, keep your pre-dose meals light, avoid greasy or overly rich foods, and limit alcohol. This ensures the medication gets into your bloodstream efficiently and provides the full effect when you need it most. Tadalafil works by relaxing blood vessels and allowing more blood to flow into the penis, but this process depends heavily on blood volume and circulation. If you're dehydrated, your blood volume decreases, your pressure fluctuates, and the medication can't deliver its full potential. Many men overlook this detail, yet it's one of the simplest ways to improve results. Urologists recommend drinking a glass of water when taking Tadalafil and maintaining steady hydration throughout the day. This doesn't mean chugging liters of water all at once. That can flush out electrolytes and burden the kidneys. Instead, sip water regularly, aiming for 6 to 8 glasses spread across the day, and a little more if you're active or live in a hot climate. Dehydration not only weakens erections, but can also intensify side effects like headaches, dizziness, or flushing, all of which are more likely when your body is low on fluids. Proper hydration, on the other hand, supports smooth blood flow, better absorption of the medication, and overall cardiovascular function. Think of Tadalafil as a tool and water as the fuel that powers it. Without enough fluid in your system, the medication can't create the pressure needed for a firm, lasting erection. By making hydration a priority, you're giving Tadalafil the environment it needs to work at its absolute best. One of the biggest misconceptions about Tadalafil is that it works like a switch. You take the pill, and an erection automatically appears. Urologists emphasize that this is not how the medication functions. Tadalafil enhances the natural process of arousal by amplifying blood flow when you're sexually stimulated, but it does not create arousal on its own. Without physical or mental stimulation, the drug will have little to no effect. This misunderstanding often leads men to believe the medication isn't working when in fact, the missing ingredient is proper stimulation. Sexual activity, whether through touch, fantasy, or interaction with a partner, triggers the release of nitric oxide in the nerves of the penis. Tadalafil then works by boosting the effect of nitric oxide, relaxing blood vessels, and allowing blood to fill the erectile tissue. For best results, men should approach intimacy without pressure or rushing. Take time with foreplay and allow arousal to build naturally. Stress, anxiety, or performance worries can block nitric oxide release, making the medication seem less effective. Relaxation and trust are as important as the pill itself. By remembering that Tadalafil is a support system and not a substitute for arousal, you set realistic expectations and avoid disappointment. When stimulation is combined with correct timing, hydration, and proper dosing, the medication reaches its maximum potential and delivers the strong, lasting results it was designed for. Even though Tadalafil is highly effective, its results are only as strong as the foundation you give your body. Urologists stress that lifestyle factors, sleep, exercise, diet, and stress management can dramatically amplify or weaken the medication's effect. Think of Tadalafil as a tool. It works best when combined with healthy habits that naturally support blood flow and hormone balance. Sleep is the first pillar. Testosterone, the hormone most responsible for libido and performance, is primarily produced at night during deep sleep cycles. Men who consistently get fewer than 6 to 7 hours of rest often notice weaker erections, no matter how much Tadalafil they take. Quality sleep ensures the medication has a strong hormonal environment to work within. Exercise is equally crucial. Cardiovascular workouts like walking, cycling, or swimming strengthen the heart and improve circulation, while resistance training boosts testosterone and muscular endurance. Better blood flow means Tadalafil can deliver maximum performance when you need it. On the other hand, a sedentary lifestyle restricts circulation and reduces responsiveness. Nutrition also makes a difference. Diets rich in fruits, vegetables, whole grains, and lean proteins reduce inflammation and support vascular health. Foods high in nitrates, like spinach and beets, even enhance nitric oxide production, the same pathway Tadalafil depends on. Paired with hydration and stress management practices like meditation or breathing exercises, these habits allow the medication to work at full strength and keep results consistent over time. Many men stop using Tadalafil because they think it doesn't work, when in reality, the issue often comes down to avoidable mistakes. The first and most common is taking it without enough anticipation. Some men swallow the pill and expect immediate results, not realizing that Tadalafil needs at least 30 to 60 minutes to begin working, and up to 2 hours for maximum effect. Impatience leads to disappointment. Another frequent mistake is mixing Tadalafil with heavy meals or alcohol, which slows absorption and weakens its performance. As discussed earlier, fatty foods can delay onset, while alcohol dehydrates and lowers blood pressure, counteracting the drug's ability to maintain firmness. Men who consistently combine tadalafil with these habits may never experience its full potential. A third mistake is not addressing underlying health issues. Conditions like diabetes, high blood pressure, obesity, or low testosterone can all blunt tadalafil's effect. While the medication can help, ignoring these root causes means results will be limited. Urologists often stress that managing chronic conditions through medical care and lifestyle changes is just as important as taking the pill. Finally, some men make the error of using tadalafil without stimulation or in a state of anxiety. Because the drug enhances arousal rather than creating it, lack of foreplay, stress, or performance fears can block its effect entirely. Recognizing and correcting these mistakes can transform poor results into lasting success. Like all medications, tadalafil can cause side effects, though most are mild and manageable. The most commonly reported include headaches, nasal congestion, facial flushing, indigestion, and occasional back or muscle aches. These occur because tadalafil relaxes blood vessels throughout the body, not just in the penis, leading to temporary shifts in circulation and pressure. Urologists emphasize that these side effects are usually short-lived and tend to improve as the body adapts. One effective way to reduce them is to stay hydrated. Since dehydration can intensify headaches and dizziness, drinking water consistently before and after taking the medication helps minimize discomfort. Another strategy is to avoid alcohol and heavy meals when dosing. Both can worsen side effects like flushing, indigestion, or low blood pressure. If muscle aches appear, light stretching, walking, or over-the-counter pain relievers, when approved by your doctor, often provide relief. Most importantly, dosage should always be tailored to your needs. Some men start with too high a dose, leading to stronger side effects than necessary. A urologist can determine whether a lower daily dose or as-needed dose is best for your situation. By addressing side effects proactively, you create the conditions for tadalafil to work effectively without unnecessary discomfort. While tadalafil is highly effective for most men, there are situations where lack of results signals a deeper health issue rather than a problem with the medication itself. Urologists warn that ignoring these signs can delay important diagnoses and treatments. If tadalafil consistently fails, it's critical to investigate the underlying causes. One major factor is cardiovascular health. Erectile dysfunction is often an early warning sign of blocked arteries, hypertension, or heart disease. If blood cannot flow properly to the penis, it likely isn't flowing well to the heart or brain either. In such cases, no amount of tadalafil will fully solve the problem until circulation issues are addressed medically. Hormonal imbalances are another concern. Low testosterone, high estrogen, or thyroid dysfunction can all reduce libido and weaken erections, regardless of tadalafil use. Blood tests ordered by a doctor can quickly reveal these imbalances, and treatment can restore both sexual function and overall vitality. Finally, chronic conditions like diabetes, obesity, and neurological disorders can interfere with tadalafil's effectiveness. These conditions damage blood vessels and nerves, making it harder for the medication to do its job. A comprehensive health evaluation ensures that treatment is tailored to your specific needs, turning a failed pill into an opportunity to improve your health at the root level. By now, it should be clear that tadalafil is far more than just a pill. It's a tool that works best when combined with smart habits. To maximize its effect, urologists recommend following 5 proven steps. First, respect timing. Take it 30 to 60 minutes before intimacy or at the same time daily if prescribed in a low dose. Second, pay attention to food and alcohol. Light meals and minimal alcohol ensure faster absorption and stronger performance. Third, prioritize hydration. Sip water steadily throughout the day and always take tadalafil with a glass of water to maintain blood flow and reduce side effects. Fourth, remember that stimulation is required. The medication enhances arousal but cannot replace it, so foreplay and relaxation are key to results. Finally, support the medication with a healthy lifestyle. Good sleep, exercise, and a nutrient-rich diet create the perfect environment for tadalafil to shine. Avoiding common mistakes, like taking it with heavy meals, skipping doses, or ignoring underlying health issues, can transform inconsistent results into reliable performance. If side effects appear, hydration, dosage adjustment, and lifestyle changes usually make them manageable. And if tadalafil still doesn't deliver, it may be time to see a doctor to uncover deeper health concerns. The bottom line: when used correctly, tadalafil is one of the most effective and flexible solutions for erectile dysfunction available today. With these 5 tips, you're not just taking a pill, you're unlocking its full potential. Combine consistency, smart habits, and patience, and you'll experience the confidence, intimacy, and vitality you've been looking for.